Hello, I'm Uchechi Okeke from Occulus Prime Eye Clinic, and today I'll be talking about esotropia. Esotropia can be defined as a manifest inward deviation of one or both eyes, and it can occur at any distance or with any task. Esotropia can be divided into three. We have the primary esotropia, secondary esotropia, consecutive esotropia, and residual esotropia. Now, for the residual esotropia, it has to do with someone that has had esotropia and then had a surgery, but even after the surgery, there still remains. So it means that even after the surgery, the patient was still esotropic. That's called residual esotropia. Then we have the consecutive. Consecutive means when someone was exo, so the patient had an outward deviation, had a surgery, and now became esotropic. That's called consecutive. Then we have the secondary. Secondary, as the name suggests, these patients had this esotropia as a result of a condition. So probably the patient had loss of vision, visual acuity, usually in childhood, right? Then we also have the primary. So it's the primary that has its sub-classifications. There might be other sub-classification of secondary, but I won't talk about that. I'm going to talk about the primary sub-classifications. Now, primary sub-classification of esotropia, I won't go in depth. I will just let you know so that you have an idea of what to diagnose or how to narrow down your diagnosis, when someone walks in with esotropia and it's a primary condition. Now, primary esotropia can be divided into constant or intermittent. So primary esotropia, first of all, is esotropia that is idiopathic, right? It didn't result from a condition, right? Now, this primary esotropia, so the first thing you think about is it constant or is it intermittent? Now, constant esotropia has to deal with it occurs all the time. So at every point in time, this patient is esotropic. Whether you're looking at far, whether you're looking at near, whether you're, doing any task, the patient has this inward deviation of the eye.